Hello, this is Beth here, Lead Nurse Educator at International RN. So I'm an experienced nurse here in the UK, and I have been teaching OSCE and doing overseas recruitment of overseas nurses for about 60 years. I also teach the CBT exam. In 2024 is when I made my own company of International RN. If you'd be interested in taking a course with us, please check out our website. Or if you want more tips and other videos for your OSCE exam or CBT exam, please check out our social media and YouTube channel. Okay, and as always, good luck with your exam.
Okay, hello, I'm going to talk to you today about the pressure area assessment for the OSCE exam. So this is a new station that's been added recently. The first part of the exam, you'll have to I would recommend you look through the marking criteria and you memorise these first 2 points. So the first one is identifies most vulnerable areas of pressure risk, and we'll give you a printed copy of this. So there's a list of the points here, and you'll be asked to list at least 5 of those in your exam. The second point, which again you need to memorise, is identify the signs that indicate pressure ulcer development. And for your exam, again, you need to list a minimum of 4 of these. Okay, so you need to learn all of these. Some of these are terms sort of different to what we would normally use in practice, so I would recommend you learn those exact words. You'll also be given a scenario, so I've got an example of one we've done here. You can see there's some patient details here and a bit of information about how they mobilise and that kind of thing. With the scenario, you then need to fill out the BARDEN, which is a risk assessment for pressure sores, dependent on your patient you have for the exam. So if we have a look at the BARDEN chart, it's split into different sections. So the first one is sensory perception, and you can rate the patient. 4 is they're absolutely fine, so that would be like your independent patient, and 1 is completely limited. So you need to score them as appropriate to your scenario. The same with moisture, so 1 is constantly moist, so like your doubly incontinent patient, and 4 is rarely moist. And then again it continues, same with activity. Number 1 is bed bound, and number 4 is walks frequently. So basically the lower score the patient has, the more unwell they are and the more susceptible they are for pressure sores. Moving on, we have mobility. So again, number 1 is completely immobile and number 4 is no limitation. For nutrition, we have number 1, which is very poor, or number 4, which is excellent. Friction or shear, number 1 is no problem. Is a problem, sorry, and number 3 is no apparent problem, so that again would be your independent patient. Once you've scored all of these, you then need to make a total score, and that should be it for your exam. You've got 8 minutes to complete this station. Thank you.